Do claimants ever recover completely, and how long would it take? Now that's interesting. If you said to me, do patients ever recover completely, and how long would it take? My answer to you is this. Like we said before, when I see patients who have early CRPS, and I get a lot from my orthopedic colleagues and GP colleagues and physiotherapists, they've usually had it for days or weeks, a couple of weeks, and everyone's in quite a high state of anxiety about the whole thing, obviously, particularly the patient. They get sent to me fairly urgently, and we see these patients and we clobber them. We clobber them with medication. We clobber them with physio. We try and fix them and rehabilitate them fast, fast, fast. And I would say in those situations, it is reasonably possible if you get the right medication in early. A lot of those patients, I wouldn't put an absolute figure on it, but a significant amount, over 50%, will improve. Now, of course, the problem, the big problem in medical legal practice is these patients are 3, 5+ years down the line. They have established conditions, and particularly with pain, the problem that we have is that once the pain has been there for 3 months or more, it is by definition chronic. And also by definition, once it's become a chronic pain problem, it is more difficult to treat, and that is the honest truth. It can be difficult. A lot of these patients end up seeing multiple medics. They have multiple therapies. In the best case scenarios, they have all the treatment and they see all the doctors and the physiotherapists first, and then later on down the line, excuse me, they have a medico-legal case. From a patient point of view, for their well-being and for their health, it is better for them to get fixed as quickly as possible. From the medico-legal point of view, unfortunately, we do see these patients relatively late. And as I say, by the time we see them, it's relatively chronic. They may have had patchy treatment, and it does become increasingly difficult to treat them. And of course, they're in this medical legal process for several years. And unfortunately, they can get entrenched behavior. It is impossible to completely untangle physical symptoms and psychological symptoms from patients who essentially their lives are on hold while they're trying to get through the medical legal process. Now, having said all of that, there's definitely some patients who will be, I don't care about the money, I don't care about the claim, make me better as quickly as possible. That's all I care about. One end of the spectrum. At the other end of the spectrum are people that want the I's and the T's dotted. They want to have every part of the medico-legal process done all the way up to trial, and they want to have a complete claim. Personally, I think if you get this condition or know anyone that develops it, by far you're better off going for rapid, aggressive treatment as quickly as possible to try and improve the situation.